Hi, this is Dr. Leslie Manson.
I'm Dr. Mark Rudy.
I'm Dr. Freitas.
Hi, this is Dr. Nick.
Dr. Kerr.
Just wanted to let you know that if you need us, we're still here.
Estamos aquí.
We're still here.
We're still here.
We're still here for you.
We mental health providers of Arizona wanted to extend our warm support and these brief educational videos to reduce stress and navigate challenges. If you need help, please reach out. We're still here for you.
Hi there, I'm Dr. Nick Arndt. I'm a psychiatrist in training. Thank you so much for joining us today. Today I am talking with one of my supervisors and one of the outstanding therapists that we have here in the clinic, Dr. Suhr. I'll let him introduce himself.
Hi there, I'm Dr. Kyle Suhr. I'm a licensed clinical psychologist working at Banner in Tucson, Arizona. I specialize in chronic pain as well as psychological assessments, and I do a lot of residency training and supervision as well. So I wear a lot of different hats.
Okay. Well, thank you for joining us, Dr. Suhr. So I know that we kind of agreed that we'll be talking about chronic pain today. And I know that's a specialty of yours. I guess just to start, how is it that a mental health provider is working in the chronic pain area, and how is that something that you do from day to day?
Yeah, I have a lot of kind of training and experience in this area. I've been working with chronic pain for a number of years. So in this area, I do a lot of work with patients on helping them manage their pain in different ways. So I teach them a lot about different ways to reduce the risk of chronic pain. So as a lot of people know, when people experience pain, it impacts pretty much every area of their life, their relationships, their mental health, their sleep. And so I try and teach patients to manage those different areas in their life and try and improve in those areas to then help decrease that risk of pain and hopefully improve kind of their quality of life overall, so that the pain seems a little more manageable than
Okay. Okay. Well, it sounds like it could be a very big topic, given that chronic pain can touch so many areas of the life. But I know that you were hoping to get across some messages about maybe how to manage chronic pain in such stressful times, or kind of given the new limitations that people are facing.
Yeah, I think one of the areas that I really wanted to talk about today was engaging in kind of activities during your kind of daily life. So as we all know, things have kind of changed quite a lot, where a lot of people are staying home, and that can really put a lot of limitations on what kind of activities you can engage in and what your day-to-day can look like. And a lot of people with chronic pain, it's not at all that much of a change from before, where a lot of people kind of stay home and they are quarantined due to pain limitations. But then when you throw on the limitations of just public health, it can create even more stress and even more pain for patients. So I think one of the important things that I've talked about a lot with my patients is trying to engage in activities during the day in a very kind of structured, routine way, and trying to help them kind of separate the different parts of their lives. So for example, in some of my patients that were working and now they have to work from home, it can be really easy to kind of blend that together with their everyday life, and then being able to separate that and say, no, well, now is my time to relax versus now my time is to work, can be a real challenge. So part of what I think is really helpful for them is try to create that routine and simulate what their work life would look like. So for example, getting up at the same day as they would as if they were driving to their jobs, and getting ready for it.
I think you said the same day, but you mean the same time every day?
Yes, yes, thank you, thank you. The same time every day,
Uh-huh.
and then do your regular morning routine as far as whatever that might be, showering, getting dressed, and then even if you have to go to sit at your computer where you are now working, maybe create a more workable environment by setting something out that simulates I'm at work. So for example, for me, I wear my work badge every day from 8 to 5 to simulate that I am working. And at the end of the day, I take my badge off, I get in my normal kind of home clothes, and then I'm able to separate myself a little bit more to say I'm no longer at work. I no longer have to think about the stress related to that. So that is part of creating that routine and that structure. And along with that is then also creating time for yourself and to take time to do things that are really important to you. And that gets into the other big piece that I talk with patients about chronic pain, is engaging in more values driven kind of activities on things that are really important to them. It's very easy to lose yourself in chronic pain where that becomes your life of trying to manage the pain, trying to get rid of it, trying to do this or that so you don't have to think about it. And you lose those parts of yourself that are really important. So when I work with patients, I try and help remind them of what it is that's really important to them and what can we do during your day-to-day life that can work toward that value, can help express it in different ways. And so it's really important that we engage in these and try and build that in, even just a little bit every single day can help reduce that pain as well as get out of the stress of working from home.
I mean, I hear you kind of just bring up the values quite broadly, but maybe you could speak to a few of those, what those might be for patients.
Yeah, so those values, it is a pretty broad topic, and that can really look like anything. The most important piece is that it is important to the patient themselves. So some values could be family, for example. So if I wanted to have a patient help express that family value more, maybe it's call your family up and just say hello. Maybe it's talk to your significant other and let them know that you love them or that you appreciate their support. Maybe it's a value of nature and just going outside onto your porch or going outside of your house and spend some time outside in the sun. That can help express your values. So there's really no specific definition per se. It's more about what is truly important to you and what can you do to be in line with that value.
I mean, I think that what I'm hearing is that maybe living deliberately or, really having a schedule and also kind of dedicating even free time towards things that we think are very important to us is helpful. I guess just what comes to mind is, why is this specific to chronic pain, or how does this end up helping with pain?
Well, I think it's important for pain because in chronic pain, we usually see that overtakes a person's life. If we were to kind of imagine two boxes, and one box is kind of your pain you experience, and the other box outside of it is your life box, that pain pretty much takes up most of your life box, where it's all about getting rid of the pain. So when we talk about living with values, what we're trying to do is increase that life box. Their pain might not change, it might not go away, but if we can help them engage in more activities and be intentional in their values, then it can make that pain seem that much smaller and seem more manageable.
Well, Dr. Suhr, thank you so much for speaking with me today. I know we're about out of time. So just wanted to extend a warm message of support to all of our patients and the public out there, and just to remember to reach out if you do need any further support.
Thank you for having me.
All right, bye now.
Just wanted to let you know that if you need us, we're still here.
Estamos aquí.
We're still here.
We're
still
here.
We're still here for you.
If you need help, please reach out. We're still here for you.